The new cool. 1540 AM, WTXY, Whiteville. Cool. 103.9 FM, W280 FO, Whiteville. The new cool, 103.9.
This Health Moment's brought to you by Southeastern Health's Southeastern Multi-Specialty and Urgent Care Whiteville. Conveniently located in downtown Whiteville, serving your urgent primary care, orthopedic, and neurosurgical needs. Call 910-207-6514.
Hello and welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and today we have the honor of speaking with Infection Control Specialist Dr. Obiefuna Okoye. He is the Medical Director for Southeastern Health and Southeastern Regional Medical Center, and he has been leading our efforts related to coronavirus or COVID-19. Thank you for joining us, Dr. Okoye.
Thank you, Amanda.
We know that you are a very busy man these days and working around the clock probably to help guide the efforts of Southeastern Regional Medical Center and Southeastern Health as we work to provide care in a safe and compassionate manner. And so if you would tell us about a couple of steps that Southeastern Health is taking regarding what we're hearing as a potential surge that may come with a large number of potential COVID-19 patients.
Thank you, Amanda. Thank you for your question, and thank you for having me today. So at this time, Southeastern has formed a committee. It is called a surge committee, and comprises of members from the administration and the key clinical and nursing staff who have been meeting daily and discussing the current projections of potential surge in the next 2 to 3 weeks. This surge committee has been planning and looking at resources and also allocating these resources and building up capacity. They have also put in place a team called the intubation team and another team called the proning team. We know that these things have applied in areas that have seen this surge, such as in New York. Also, they have built up equipment, including ventilators. Also, staffing issues have also been discussed, and potential reach out has gone out to other medical or healthcare providers in the community to volunteer to assist with this potential surge that is coming on. So the team has been working tirelessly, and like I said, we have meetings by conference calls daily, reviewing these plans and making changes as need may be.
Yes, sir. And we understand that these measures that we're taking related to social distancing and staying home is supposed to, what we're hearing, is flatten the curve so that we don't have as bad of a surge. Is that correct?
Exactly.
Right,
So yeah, that's the plan. This is teamwork. We have been advising patients and the community to keep up with what the public health experts have been telling us, because this is teamwork. Everybody has to be on it together.
Right.
Social distancing is a key component. As we all comply with social distancing, we plan or hope that we can flatten that curve so that the healthcare system is not overburdened.
Right.
So it's teamwork for everybody, and we continue to advise and put out this information for people to comply with this shelter in place and social distancing orders.
Yes, sir. So what's one thing that the listeners should know that Southeastern Health is doing to ensure the safety of not only their employees but their current patients during this time?
Okay, that's another good question. So Southeastern Health has gone with guidance from the World Health Organization, the CDC, and the State Department of Health and Human Services. At this time, patients are screened even before they get to the hospital or get to the medical facilities. And if these patients are potential high risk, they are isolated even before they come in contact with the health system. Also, employees are screened at a point of entry to the facility every day, and screening will involve travel questions and then symptoms, and the temperature is all checked. And with these things, high risk patients or employees are actually singled out and advised to given the necessary advice if they need to be in quarantine or isolation and to be tested. That will be done. So the key things are screening before patients get to the health facility, and also screening employees. Other things that are also being applied include a universal mask policy. Everybody who's on the facility has to wear a mask, a surgery mask, and also we talked about social distancing. So now employees also comply with this social distancing recommendations. So these are some of the things that are in place at Southeastern Health presently.
Yes, and I was aware that we were reminded recently not even to have meetings of more than 10 people because of the governor's order, for no gatherings of meetings over 10 people. So even we're doing that within the organization.
Exactly. That is a component of social distancing. People, when numbers are that high, meetings are scheduled by a video conference or teleconference, and we don't encourage groups of people more than 10 to meet anywhere in the healthcare facility at this time.
And a lot of our employees are telecommuting or working from home as much as possible as part of that social distancing as well.
Exactly.
So, Dr. Okoye, how will the listeners in our community know if what we are doing has been successful? What is success going to look like for COVID-19?
Success, again, like I said earlier, this is a teamwork. We're all working together, and the success is if we keep infection in our community and amongst our employees to the barest minimum, to the lowest number. But I can't say zero at this time because we know we've had cases, but if we can keep our numbers low, that will be a tremendous achievement, given that teams have been working together, including the community and healthcare providers. Again, the goal we aim at now is not to overburden our healthcare facilities. I'm still going to keep coming back to social distancing. We know that at this time there's no vaccine for COVID-19 and there is no cure in terms of therapeutic medications to treat. Most medications are still under trial. So the key thing we know now is prevention. And prevention is we stay at home, shelter in place, social distancing, keep our distance from people, and then we do some other basic simple things. Wash our hands always, cover your mouth when you sneeze and your nose when you sneeze, and most importantly, if you think you're sick, you stay home. You can call your provider from home, and then your provider should guide you on the next steps. So prevention is key for us at this time.
What is if there was one thing that you would recommend to the community to do, to the general public, that would help slow the spread of virus? Is there one thing that stands above all else? Is that hand washing? Is that social distancing? Or is it just one? Can it be singled out as just one thing, or do all these efforts need to go hand in hand?
I think all the efforts need to go hand in hand. I don't think we can just single it out one thing. All need to go hand in hand. But most importantly, let us listen to the advice from our public health experts. Social distancing is a component. Washing our hands is a component. Cover your mouth, your nose when you sneeze is a component. Disinfect areas that are heavily touched by people. Keep your hands away from your face. And again, if you're sick with symptoms that you think may be COVID-19 symptoms, call your provider. So I think all this will go hand in hand. I'm not too sure I can single out one that is not that will be the most important.
Right. Well, we're going to take a quick break, and we're going to come back. We're talking today with Dr. Obiefuna Okoye. He's an infectious disease specialist with Southeastern Health and Southeastern Medical Center. So join us after the break for more with Dr. Okoye.
Thank you very much.
Southeastern Multi-Specialty and Urgent Care Whiteville, which is owned and operated by Southeastern Health, is conveniently located at 117 East Main Street in downtown Whiteville. For urgent primary care, walk-in visits for minor health issues Monday through Friday from 8 to 5 p.m. without an appointment. Orthopedic and neurosurgery visits are available by appointment. For more information, call 910-207-6514. That's 910-207-6514.
Whiteville's hometown station, the new Cool 103.9.
Welcome back to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and today we've been talking with Dr. Obiefuna Okoye, Infectious Disease Specialist with Southeastern Health and Southeastern Regional Medical Center, and he has been leading the efforts in the fight against coronavirus or COVID-19, and today we've been talking with him about some different things related to that issue. And Dr. Okoye, if a person feels like they're experiencing symptoms of COVID-19, what should they do?
Okay, good question. So again, the key thing is I will recommend to get in touch with your healthcare provider or your primary care provider to discuss your symptoms and explain what is going on with you, and they should be able to walk you through what will be your next steps. In the event that you do not have a healthcare provider, I will recommend to get in touch with your local health department via phone call, and also be able to discuss your symptoms with them, and they should be able to put you through the next steps to take from there.
And would you also review, just for the listeners, again, I know we've seen it sort of almost, I wouldn't say information overload at this point, but I know that we're getting information from everywhere. And so if you would just remind us, are the symptoms pretty much staying the same as what we've heard? And if you would go over what those symptoms are.
Yes. Okay. So the most common symptoms we are seeing includes fever, cough, and shortness of breath. Other symptoms that have been reported is loss of taste. Also, we've had people coming in with headache, sore throat, and body aches. But the most common symptoms that we have come across is fever, cough, and shortness of breath. Some people also may have confusion, and some people may see their lips or their extremities or turn to blue color. Okay, but the most common symptoms remain fever, cough, and shortness of breath.
And is the shortness of breath, what is the cause for most people who have to be hospitalized from coronavirus?
Yes, the most common cause that leads to this hospitalization is the shortness of breath, because we know that this infection involves the lungs, and the lung is not able to exchange air like it should. So people describe shortness of breath, and we find out that their oxygenation has dropped and fallen low. So they come in distress. Some of them really get sick that they have to end up on the ventilator to support their breathing.
And we've heard that people may experience worse symptoms because who may have comorbidities or other issues. Is that correct?
Exactly. So we also know from studies coming out that people who do badly with this infection are people who have underlying medical conditions such as hypertension, diabetes mellitus, and people who also have underlying lung diseases like emphysema, chronic obstructive pulmonary disease, also people who are on dialysis, or people who are transplant patients. So we know that they do not do particularly well when they get this infection.
And for those reasons, again, we're social distancing to stay away from those folks so that they do not get exposed to it, because we know they have a harder time with it.
Exactly. And most importantly, I didn't mention this group of patients, our elderly patients. So at this time, we have been recommending people stay in touch with their grandparents over phone or things like FaceTime or teleconferencing video calls, but to keep their distance from their grandparents or elderly parents, because we know that these people also don't do particularly well if they get this infection.
Right. This is the perfect time to embrace the technology that we have. Maybe time to learn it if we don't really understand it. I've heard about some things like Zoom and other things, that people are using to help stay in touch, but remotely.
Exactly. Exactly.
So Dr. Okoye, we've heard a lot about masks and who should wear them and when, but what is the benefit to the public who do not have symptoms of wearing masks in public? If you'll talk about that initiative.
Very good question. So, again, like I talked initially, we take guidance from the CDC, the World Health Organization, because they have data related to this infection. So what has come out of recent is that people who do not have symptoms, who do not show any signs of the infection, can transmit this infection. They may feel well, they may be walking around, but they are infected, but they are not showing any symptoms. So they can transmit this infection. So that was why this guidance came from the CDC for people to wear masks or face covers when they are out in public, because this will reduce chances for those patients who do not have symptoms to transmit it to other patients. Okay.
And what's the best piece of advice that you could give our listeners as they try to cope with this pandemic? Do you have?
Yes. So what the advice I will give to people is for us to think any action we are taking at this time, we should really evaluate and ask ourselves, is this action putting me at risk or putting someone else at risk to acquire this infection? Am I listening to the guidance we're getting from the experts about this infection? Am I complying with what the experts are telling us? So this is how I'm going to summarize it. We ask ourselves, for each action we're taking at this time, am I protecting myself and my family? Am I putting myself at risk, or am I putting someone else at risk? Am I listening to what the experts, and am I following the guidance of what the experts are telling us? Like I said earlier, this is teamwork. We all have to do our own bit, and if we do our own bit, we will come out strong at this time of distress.
Absolutely. And even if you have to go out for essential groceries, there's signs now at the grocery store, please remain 6 foot apart. It's like you said, it's teamwork for us all to comply with those measures. If you would just sort of go back over, those stay at home, social distancing, just those reminders, if you would, those important keys.
Okay, sure. So exactly as our public health experts have been telling us, social distancing, 6 feet away from people, wash our hands, do not touch your face. Make sure, even if you have to touch your face, wash your hand. If you don't have soap and water close by, you can use the alcohol wipes or alcohol gels. Or cover your mouth, your nose when you sneeze. If you think you're sick, stay home. You can always call your provider, or you can call the health department. The social distancing, stay in touch with people over the phone.
Right.
You don't have to go out to be in touch with people. Again, now we are saying, do not shake hands. We're not shaking hands anymore. Now you can bow down if that's the way you want to express. You can bow to any people, but keep your distance. Also, embracing. We are keeping away from surge, from embracing. When you cough or sneeze, cover your mouth, cover your nose. Make sure you're wearing a face cover, face mask when you're out in public.
Right.
If you have symptoms, like I already said, call your provider, call your local health department. And let's, like I said, the common sense things, let's ask ourselves, whatever action we're taking, am I being responsible? Am I listening to the advice? And am I complying with the advice that is coming from our public health experts?
Well, thank you, Dr. Okoye. We're hearing about healthcare heroes. You are definitely our hero. You are on the front line actually leading the efforts, and we appreciate your unwavering commitment and your dedication and all the time that you've committed to this. And we appreciate you taking a few minutes out of your schedule today to talk with us and maybe share a little bit more with the community about some things that we all need to be reminded of so we don't become complacent. So thank you so much for joining us, Dr. Okoye.
Thank you very much, Amanda.
And thank you for listening to Southeastern Health's Healthy Connection.
Southeastern Multi-Specialty and Urgent Care Whiteville, which is owned and operated by Southeastern Health, is conveniently located at 117 East Main Street in downtown Whiteville. For urgent primary care, walk-in visits for minor health issues Monday through Friday from 8 to 5 p.m. without an appointment. Orthopedic and neurosurgery visits are available by appointment. For more information, call 910-207-6514. That's 910-207-6514. 6514.